A Victorian nightmare returns, drug-resistant TB on the rise in Gloucestershire. Imagine a disease so deadly it claimed millions of lives during the Victorian era, only to resurface in the 21st century with a dangerous new twist. Tuberculosis, TB, once known as consumption, is making a startling comeback across Gloucestershire, and this time, it's bringing a drug-resistant strain that's harder to treat. But here's where it gets even more alarming. The UK Health Security Agency, UKHSA, reports a 13% surge in TB cases in England in 2024, with Gloucestershire seeing troubling increases in areas like Gloucester, Cheltenham, and the Forest of Dean. The numbers don't lie. In 2024, England recorded 5,490 terabytes notifications, over 600 more cases than the previous year. While the national rate of 9.4 cases per 100,000 people is just shy of the World Health Organization's low incidence threshold, the trend is undeniably upward. Gloucestershire, though still below the national average, isn't immune. Cheltenham, for instance, saw its TB notification rate nearly double from 2.2 to 4.1 per 100,000 people. Meanwhile, Cotswold and Tewkesbury experienced declines, leaving experts puzzled about the uneven spread. And this is the part most people miss. Drug-resistant TB now accounts for 2.2% of all lab-confirmed cases, the highest level since enhanced monitoring began in 2012. This isn't just a medical challenge, it's a ticking clock. If left unchecked, the UK risks losing its low-incidence status for TB, a title it's held since 2017. But why is this happening? TB remains closely tied to deprivation, with higher rates in urban areas and among vulnerable populations, including the homeless, those with substance dependencies, and individuals with criminal justice involvement. A global killer with local implications. Worldwide, TB killed an estimated 1.25 million people in 2023, surpassing even COVID-19 as the deadliest infectious disease. In England, 82% of TB cases in 2024 were among non-UK-born individuals, but cases are rising across all demographics. Dr. Esther Robinson, head of the TB unit at UKHSA, warns, TB is preventable and curable, but with rates increasing, it remains a serious public health issue. We must act fast to break transmission chains through rapid identification and treatment. Symptoms to watch for. TB is no longer the death sentence it once was, but early detection is crucial. Symptoms include a persistent cough lasting over 3 weeks, fever, chills, unexplained weight loss, and fatigue. If you've spent time with someone who has TB or recently moved from a high-incidence country, don't ignore these signs. Coughing up blood? Seek urgent medical attention immediately. The controversial question, are we doing enough? While medical advancements have made TB treatable, the rise in drug-resistant strains raises a provocative question. Are our public health strategies keeping pace with the evolving threat? Some argue that more resources should be allocated to vulnerable communities, while others believe stricter border controls could curb imported cases. What do you think? Is this a matter of better healthcare access, improved surveillance, or something else entirely? Let's spark a conversation. Share your thoughts in the comments. This is one debate we can't afford to ignore.